Thank you for joining us today at the PACE Center here in Grand Prairie. My name is Jackie Clayton, and I am the Mayor of the City of Grand Prairie, and I have the privilege of serving as the Mayor. Before we begin, I'd like to acknowledge that we are located on Treaty 8 territory, the ancestral and treaty territory of the Dene, Cree, and Métis. We acknowledge the Métis, Inuit, and First Nation whose footsteps marked these lands for generations. We recognize this land as an act of reconciliation and gratitude to those whose territory we are on. I'm very happy today to be joined by Associate Minister Jackie Homeniuk, Armstrong-Homeniuk, as well the status of women, as well Jackie Aitken, the Executive Director of PACE, Sarah Blake, Senior Comms Advisor from AHS, Candice Eady, Senior Operating Officer from AHS, and Dr. Bear from AHS. Without further ado, allow me and join me in welcoming Associate Minister Armstrong-Homeniuk to the microphone.
Good afternoon. I think to be here, you could only be a Jackie today, so. Good afternoon. Thank you for joining us here today. I want to acknowledge that today is Sisters in Spirit Day. I'm pleased to be here to announce a pilot project to support survivors of a sexual assault in rural Alberta in consultation with Advanced Education, Justice and Solicitor General, Health and AHS to expand training opportunities for healthcare professionals to perform sexual assault evidence kit exams in rural Alberta. Every person that has been sexually assaulted deserves access and care and for forensic evidence collection regardless of where they live. If survivors choose to file a report and seek evidence collection after an assault, collecting physical evidence within 72 hours of the assault increases the likelihood of obtaining forensic evidence. This is why it is critical to ensure that more sexual assault survivors have access to proper care and support. Sexual assault kits are deployed by police in the collection of forensic evidence for use in investigations of sexual assault. Being a woman from rural Alberta, I understand the unique challenges that women in rural and remote areas in our province face. Unfortunately, one of the challenges is accessing sexual assault evidence collection. Often, victims of sexual assault in rural and remote Alberta need to travel significant distances to access these services. Sexual violence crimes have the lowest reporting rate amongst violent crimes in Canada. It is estimated that only 6% of these crimes are ever reported to the police. At the same time, these crimes have a remarkably low conviction rate of just 0.3%. Since becoming Minister of the Status of Women, I have made it my priority to close these gaps and increase the support we provide survivors, including their access to forensic evidence collection. Increased access to evidence collection further empowers sexual assault survivors to report crimes committed against them. I am pleased to announce that our government is investing $1 million to announce and launch a new Made in Alberta training program for forensic evidence collection and sexual assault to ensure that more healthcare providers can deliver the essential services in communities across Alberta. Every person who has experienced sexual assault in Alberta, no matter where they live, deserves access to care and evidence collection. This pilot project will help increase the number of healthcare providers in rural areas that are trained in providing sexual evidence kits. The Rural Sexual Assault Support Project will be piloted with a group of healthcare professionals across rural Alberta in communities that need it the most, and will include grants to ensure healthcare providers are able to access this training free of charge. Alberta's government is committed to providing the resources that healthcare providers need to perform these exams for all survivors of sexual assault. It's time to work together to make sure all sexual assault survivors in Alberta have access to this exam, regardless of where the assault occurred. I'm proud that our government is making this a reality. Thank you to everyone who continually steps up and provides support for survivors of sexual assault, including organizations such as PACE, who work tirelessly to ensure that sexual assault survivors have access to the support and services that they need. Thank you for hosting us today, and thank you for the work you do every day.
Thank you, Jackie. I have worked in this field now for 40 years and was one of the founders of PACE a long time ago. And it was founded coming out of a meeting pulled together by the RCMP after a horrendous sexual assault that they were taking through the court system. We are delighted that medical resources to support victims of sexual assault are going to be developed for rural emergency departments and primary care facilities, especially northern rural. We are well aware of the amount of sexual abuse. The Alberta Association of Sexual Assault Centres redid the study done in 1984 by Badgley, where they found that 45% of adult Albertans will have been sexually abused at some point in their lifetime. That is a large number. And they found 44% of girls and 24% of boys would have experienced the sexual abuse prior to age 18. That compared to 22% of girls and 9% of boys that reported that in the Badgley study that was done in 1982. The rural rates of sexual assault within the family are 3.5 times higher than urban rates. Common assault within the family is 4.7 times higher in rural communities versus urban communities. And the rate of violent crime against young girls is higher in the north than the south. So it is so important that we have rural resources to stop the sexual violence. Given that we now understand that sexual assault and trauma plays such an important part in whether or not we have a mentally and physically healthy community, we know what trauma does now. We have to take sexual violence seriously and encourage victims to access supportive medical and justice services. We will continue to have the majority of assaults going unreported and the reported assaults, the majority going not cleared by charge. And when in the adult criminal justice system, fewer than half receiving a guilty verdict if we do not start taking the offense of sexual assault seriously. And the only way we can do this is by ensuring that victims throughout Alberta are treated with dignity and respect. Ensure that good evidence be brought to the courts, and then maybe we can ensure that we're all giving the message to offenders that sexual assault is not acceptable. Thank you.
Well, thank you, Jackie, and thank you, Associate Minister Armstrong-Homeniuk. Thank you all for joining us here today. This initiative will make a significant impact in our community and continue to help us be a more caring and inclusive community. That'll now bring us to the end of our formal program. I'll pass it over to the comms team to moderate questions from the media. Thank you.
Thank you. We will now take some questions from reporters. We'll start with those here in person and then move to the phones. Just a reminder to reporters, it will be one question, one follow-up. Please state your name and outlet for the record. Please also specify who your question is directed to. Please come to the mic and ask your question.
Luke Ettinger, CBC News. Question for Associate Minister Armstrong. How many people will be trained through this pilot project?
The pilot project, we would like to train two I would say, trainees in every hospital in Alberta. So that works out to about 190 people.
And you mentioned it can be quite a distance to travel for one of these kits. So how far are patients, say, for example, in Grand Prairie traveling right now?
Right now, they're traveling to Edmonton.
Okay, next question.
Hi, Minister. Erica Fisher, Today FM, mygrandprairienow.com. Why Grand Prairie? Why is this the place that you want to start?
Well, we see the need in the north for supports and rural Alberta, and Grand Prairie is a great place to start. The west side of the province is a little, there's less resources out this way. So we know PACE is such a great partner, so we've decided to come out here.
And how will you measure success for this pilot project? How will you know that this is something that is working here and could potentially work other places?
Well, it will be all across the province, so we'll be gathering data across the province and comparing it. And because it's a pilot project, there's a short timeline, so we'll know real quick how successful it is. And I'm betting it's going to be pretty successful.
Hi, Jesse Boyley, Town and Country News. You mentioned the higher rates in the North Zone, especially in this area. You know, do you see this program helping lowering those rates?
Well, this will allow more reporting. So throughout the entire province, actually, rural Alberta, there will be more reporting because there will be easier access for the evidence collection.
Sure, thank you.
Okay.
Tanner Smith, Everything GP News. I just was wondering, you mentioned that lots of these, it's increasing of a lower rate when it comes to people actually coming forward and reporting these crimes. Do you believe this program will lead to more people coming forward and reporting these crimes and talking about it and opening up about their experiences?
Well, when there's easier access to evidence collection, it allows the conversation and actually supports to come in place, so there will be more reporting amongst victims.
Awesome. And just my follow-up question, do you believe this would also lead to more people becoming, you mentioned court cases, it's a very low chance of people actually being incriminated for these type of assaults. Would you believe this will also raise the bar on that and have people being more incriminated for these?
Yes, because people will realize the amount of supports out there, and it makes it easier reporting at that time.
Awesome. Thank you.
Any more questions from the room? All right, seeing no more from the room, operator, are there any online?
There are no questions in the queue at this time.
Thank you, everybody.